Hi everyone, my name is Emily Strom and I have a Bachelor of Science in Healthcare Administration from CSULB, and I've also worked at St. Joseph Hospital in Orange as a clinical data analyst and nursing assistant since 2016. My topic today will be why we need to vaccinate. So throughout my time at the university, there is this universal truth that prevention is better than a cure. However, in the hospital setting, this idea that a prevention is better than a cure is kind of on the back burner because patients come in with symptoms and we have to treat that. So essentially, a couple weeks ago, a young patient comes in with a suspected COVID-19 infection. After labs are resulted, it's determined that this patient has tuberculosis. I couldn't have helped it being a part of this patient's care team that this could have been prevented through vaccination. Ultimately, vaccines are able to save lives, they're cost effective, and they're safe. And they could have prevented this young patient from having to be hospitalized with the TB infection. Vaccines are able to improve the length and quality of life for all. Before COVID-19, there have been plenty of diseases that have caused deaths and other ailments throughout the world. And through vaccination, we have been able to eliminate some of those diseases. For example, smallpox was considered eradicated by the World Health Organization in 1980. Polio, which is a paralytic disease, is on its way to being eradicated. According to Vandersloot et al. In 2019, the vaccine for polio was developed in 1955. And in 1980, the number of cases was 350,000 to 400,000 cases per year. However, in 2017, only 22 cases were reported thanks to vaccination. Although we do have a lot of vaccines, it's important that we are able to vaccinate everybody in order to prevent these diseases from causing death. So if you look at this graph from ourworldindata.org, the number one cause of death by preventable diseases in the world in 2017 was tuberculosis at 1.18 million. Vaccines not only save lives, but they are also cost effective. The price of vaccines vary throughout countries, and in the United States, it is a little bit higher than other places. However, according to Marks and his team in 2014, hospitalization due to a standard tuberculosis infection in the United States was $17,000. And if that TB infection was drug resistant, could cost up to $430,000 to treat. From this graph below, the vaccine for tuberculosis called BCG, the cost per dose in a developing country is 16 cents to $1.11, and the cost per dose in the United States is $100 to $200. However, even though in the United States it seems kind of pricey to pay $100, $200 for a vaccine, it's much cheaper than paying up to $430,000 to treat it. So again, prevention is better than cure. Vaccines are also very safe to use. According to the CDC in 2019, besides a weakened or killed disease antigen, vaccines contain very small amounts of other ingredients. And these ingredients fall into these categories. You have preservatives, which prevent contamination of the vaccine. You have adjuvants, which stimulate an immune response, and stabilizers, which maintain vaccine potency. One of the ingredients that has caused some controversy is an aluminum salt, and this comes from concerned people not wanting to expose themselves or their children to more aluminum than they need to be. However, aluminum is the third most abundant element on Earth. It is found in the food we eat. It's found in breast milk and infant formula. So even breastfeeding mothers, new moms, you are still exposing your children to aluminum just by feeding them. And Glantz et al. In 2015 determined that issues with vaccine ingredients are typically associated with a topical irritation only. They do not cause other problems, maybe just some redness or soreness after receiving your vaccine. Vaccines are also safe because they help the communities develop a herd immunity. Herd immunity occurs when the more individuals are vaccinated, the higher the indirect protection for non-vaccinated or low vaccinated individuals. These non-vaccinated or low vaccinated individuals could be babies, toddlers, and immunocompromised individuals such as HIV/AIDS patients. Roland Pierrick in 2018 discusses how when the majority of a population is vaccinated, the disease cannot circulate in the population and gain a foothold in the society. It is through herd immunity that mass vaccination is so much more effective than an individual vaccination. And the image below kind of shows how a low immunization rate versus a high immunization rate, the chance of an infection occurring. So in the low immunization rate, the red dots indicate infected non-vaccinated individuals. On the left-hand side for low immunization rate, there are many more red dots and many more susceptible white dots, which is a healthy, not vaccinated individual, and they could pass their disease onto them. Versus in the high immunization rate, you have a lot more healthy vaccinated individuals to buffer those people who are infected and not vaccinated. Herd immunity also has a threshold. So in order for herd immunity to be affected, you need to have a certain percentage of the population vaccinated against that disease to prevent the spread of it to non-vaccinated and low vaccinated individuals. According to the Mayo Clinic in 2020, the more contagious a disease is, the greater the proportion of the population that needs to be immune to the disease to stop the spread. So this chart below, you can see for an example, the disease measles, the herd immunity threshold to have a herd immunity against measles, you need to have 92 to 95% of the population vaccinated in order to prevent an outbreak. So this is really important. And it also shows that herd immunity can work if people are compliant with vaccinations. Ultimately, prevention is better than a cure. Vaccines are able to save lives, as we've seen through the eradication of smallpox and the significant decline of polio diseases. Vaccines are cost effective. It's a lot cheaper to have a vaccine prevent an infection from occurring versus treating that infection in a hospital setting. Vaccines are also safe to use, and the ingredients that are in them are safe, and they help provide herd immunity. Ultimately, it's really important that you go get vaccinated. If you're interested in that, please schedule an appointment with your physician and get your children and family members vaccinated as well. If you're already vaccinated, you can ask your physician if booster shots are needed. If you're uninsured or underinsured, visit your state's local or Department of Public Health website to learn where to acquire free or discounted vaccines in the US. The link below is for the state of California. Please stay healthy and get vaccinated. Thank you.